Hello and welcome to ET Now Health Ranking and Conclave. Today we have with us Dr. Teesta Banerjee. She is a consultant gynecologist at Peerless Hospital. Hi ma'am, how are you doing today?
Hello, I'm doing fine and my pleasure to be present with you on this platform.
Thank you so much ma'am. Ma'am, as a woman, sometimes we forget to take care of ourselves, especially in, while taking care of other people, we definitely do. So the first question for you would be, what is menopause?
Menopause is a very important junction in a woman's life. So as the name goes, menopause means cessation of menses, that is when the menstrual bleeding stops. But I would refer to a wider meaning, that is gradually the ovarian hormones that support a woman's reproductive process and the entire sexual life, those hormone levels begin to fall, ovary gradually stops functioning, and gradually she transcends into menopause. So in a broader aspect, it marks a landmark in a woman's life. Just as the onset of menses, menopause is equally important as a phase of a woman's life.
How does a woman know that she's reached perimenopause?
Yes, so busy as we all are, taking care of our families, spouse, children, women usually tend to notice smaller changes. It does not just happen with a bang. It's something like you notice small fluctuations in the menstrual cycles, or maybe some kind of heavy bleeding or some change in the bleeding pattern that has not been there before. These changes happening. Most often, women come to us reporting that they are experiencing irritability, mood fluctuations, like situations where they wouldn't react normally. They are unable to handle that, and that is causing some changes in their mood stability. Then again, there is some kind of sexual dysfunction also associated. So we are at an age where we women don't limit ourselves. We try to live our life to the fullest, and there when some kind of changes crop up that limit our functioning, that is when it's perimenopause. It's happening, those small muscle cramps, that fatigue, that irritability, that lack of sleep, all those small things actually add up to menopause knocking at the door.
Also, any other major health issues that you should look out for, during or for perimenopause?
Yes, so as I say, menopause is a very important junction in a woman's life. So we need to look out for the overall changes in health. Interestingly, a female body is very much dependent on these reproductive hormones, as we know, estrogen and progesterone. And when these hormones decline, they lead to loss of bone mass, they lead to atrophy of the sexual organs, they lead to subtle changes in blood health, in heart health, and almost every system of our body. So maybe the woman has walked into my clinic with some subtle problems regarding menstruation, but we like to utilize that opportunity to look out for bigger problems that might be hidden under the surface. So as we all say, menopause might just be the tip of the iceberg, and we utilize that opportunity to do some screening. So by screening, we mean we look for onset of diseases that are particularly common in that age group. And we do screening for breast cancer, we do screening for cervical cancer, and we have different imaging modalities available in Peerless Hospital. So as we all know, Peerless Hospital operates on a multidisciplinary approach, and we have got specialists for every single discipline, and we work together as a team. So as a gynecologist, I would run the specific tests for the screening purpose with the imaging and blood works, and if we find anything suspicious, we have got our specialists to take care of the woman. So as we say, a general health checkup at the menopausal age, that I would say between 40 to 50, is very much necessity for every woman.
Now, since our body is also changing so much, what are the lifestyle changes that we should make before or after menopause?
So, lifestyle changes are very much essential during menopause. As for general well-being, we all know that nutrition and exercise, they play vital roles. But menopause is where you need to understand your body. You need to understand the demands of the body according to the hormonal changes that are happening. So, first and foremost, women tend to lose muscle mass. That is when the muscle atrophy sets in. So, small movements like climbing up a flight of stairs or taking a short run to catch a bus, that might seem extremely tiring or exhausting, and you might end up with palpitations. So basically, it's your muscles giving way. They are losing their strength. The other thing is bone health. So bone density often drops, leading to low back pain, leading to chronic fatigue, neck pain, and so on. The other thing is, previously in older generations, women were not that much aware of their sexual health. So menopause is the time when a lot of women experience vaginal dryness and they have difficulty having sexual intercourse. And at our Peerless hospital, I would say the doctor's room is the safe space. It's a closed box, it's a safe space where women can put forward all their queries, however minor it might be. It might be just some kind of skin changes, it might be a small lump in their breast, it might be some issue of vaginal dryness they're experiencing. And also, to carry forward, they might have some difficulty in urination. Most women report a difficulty in urination, or might be at night time they are having increased urination. All of these changes are happening because of menopause, because of the hormonal fluctuations. So we suggest all the women not to ignore, but to explore their bodies and listen to what they're asking for.
So with lifestyle changes also comes nutrition, right? So, and many people are now actually going into fitness and nutrition as well. Carbs is something people are actually afraid of. My question to you is, what variety of rice should be a part of your essential diet, since rice is a staple for all of us?
Rice is actually carbohydrate, and it's a very easily assimilated form of carbohydrate. So I would suggest, since for us Bengalis, rice forms an integral part of diet, the secret lies in portion control. So as Indians, different studies have revealed that Indians lack in protein content. So our diet needs to be rich in more protein and less of carbs. More fibers are always good for bowel movements and also for nutrition purpose. So you actually can cut down on calories by shifting the proportions in the food you consume. And apart from that, for menopausal women, we always stress on exercise. So not just simple walking, we are trying to bring back those muscles into function. So that's where small training sessions, different activities, muscle targeted activities, isometric exercises, or maybe short term exercises with weights, they come into use. Apart from that, we have different short procedures, OPD based procedures like laser treatment of vagina that will promote the vascularization of the tissues, and they help in menopausal changes. As it is, like different women come from different clinics or different hospitals from the periphery who have been continuously taking antibiotics for vaginal itching, vaginal dryness. At Peerless Hospital, we are actually able to treat them with proper hormone replacement therapy, with proper monitoring and screening services.
That's great, ma'am. I hope this was very helpful for all the women here. Thank you so much for all the knowledge that you've given to us. Thank you so much for talking to us.
Thank you.